Well, a new behavioral hospital is coming to Lubbock with a focus on mental health challenges like depression, anxiety, and other behavioral concerns. KCBD News Channel 11's Natalie Falkenberry joins us live now from that new facility with how this new hospital aims to bring new options to our community. Natalie.
Well, Karen, I'm here at the new Oceans Behavioral Hospital near North Quaker in Princeton, where this facility behind me is aiming to serve the underserved of West Texas.
Lubbock came up as one of the most underserved markets.
Mary Beth Moran, the hospital administrator for the Oceans Behavioral Hospital, says even with the two hospitals here in Lubbock, the care for psychiatric adults can't keep up with the demand.
For patients that need psychiatric care is usually quite lengthy. They have a hard time finding beds that are available and sometimes have to reach throughout the state of Texas in order to find a bed for a patient.
Moran says having a 32-bed facility that will offer inpatient and outpatient care is the first step in assuring the population will get the help that they need.
So our hospital will serve mainly geriatric psych. Our patient population is 50 and older.
With a focus on adults and senior citizens, Moran says it was important that the hospital worked closely with local nursing homes and existing hospitals.
So are working with all of the nursing homes and hospice and other independent and assisted living facilities in Lubbock, and the positive response that we've gotten from those agencies has been fantastic.
Moran says one of the most important steps in the process of this facility was hiring staff that is passionate about diminishing the stigma behind mental health.
And I really believe in this community, and I've been able to find, been able to staff the whole hospital in people who were from the area that really have a passion for caring for psychiatric patients.
Moran says Oceans is looking forward to serving the Lubbock community, and if everything goes as planned, the hospital will begin seeing patients January 31st. Karen?
Great news. Thank you, Natalie.